Hello, everybody. Welcome to our summer webinar series, Ahead of the Curve. We are helping independent pharmacies prepare for what's next. And I'm so glad. So, to be absolutely honest with you, Brad and I have tried to record this as a podcast, record this as a live webinar. We've tried many, many times to get this done, and something inevitably has come up. So, I am so glad that Brad is here with, correct me if I'm wrong, a brand new program by RxGenomix. So this is staying ahead. You know, I have been out. So DiversifyRx has hit the conference trail this year. So we've added about 10 conferences to our agenda this year. And so I love going to conferences, not for the opportunity to sell. I mean, yes, I would love to sell our memberships. And by the way, if you're not a member, become a member. But we get to chat with people. I get to chat with partners. I get to chat with pharmacy owners, meet new pharmacy owner friends. It's just fantastic. So I'm so thrilled that I've gotten the opportunity to speak with more folks face to face. And one of the things that I've learned this year is everybody wants to know about anything new that's coming up, which I love that about pharmacists. I think we've kind of hit a corner in the last couple of years where it used to be all about, well, this is the way we've always done it. And I think we are pivoting very quickly, I might add. Everybody give yourselves a pat on the back to what's next. How do we stay ahead of it? How do we stay in front of it? And I'm just so thrilled that those types of conversations are happening. And Brad, I know that you are always looking for the next thing.
Yeah, I've been told that I'm always ahead of the game. I'm maybe hopefully this time it's everything's come together and caught up, and I'm not too far ahead. So hopefully it's starting to come together. So.
That's right. That's right. Sometimes it feels like we're too far ahead. So, like I said, this is our webinar, Ahead of the Curve. Now, I mentioned it before. If you are not a Badass University member, now's the time to join. And I talk about this often. If you are unsure that your staff, that you will take the time to work the membership, start easy. Start with our $200 a month newsletter that comes right to your mailbox. And this is not just a newsletter that has some baloney in it. So these newsletters, I brag about Lisa often, and I'm going to do it again. She writes these every month. It is one solid strategy that you can implement, or your staff, it does not have to be you, the pharmacy owner, or your staff can implement, and it will make a change. So if you are nervous about joining because of time commitments, or you're afraid of getting one more subscription and never using it, I am the most guilty of that out of all. This is a great way to start. So scan the QR code. If you don't get the QR code in time, always text me, call me, send a carrier pigeon, any of the ways. I think someone last week said, Heather, like, do you have two phones? And I said, no, why would you have two phones? Like, I didn't even, and he's like, well, your phone number is everywhere. And I said, well, that's my life. Like, I just live one life, friend. So no, if I had two phones, I would be a complete mess. So when you text me, you are texting my actual phone. So any questions I can help with, I'm happy to do so. Okay, so within our Pharmacy Badass University, we have a 4-step profit matrix. And this is our road guide, our absolute guide on how to reverse poor cash flow and low profits, build strong businesses and foundations, scale your profit pharmacy, and step 4. Now, step 4 is where Brad lives. And he is at PGX. He's right there with the gold around there. So Brad's strategy, his solution is on the profit matrix already. We already do have some of Brad's earlier work in our membership as a course. So this one will be added, and obviously we're big fans of his. So that brings me to the next point. This is Brad Tice, the CEO of RxGenomix. I made a mistake and did not put that right on there, but I'm sorry. The G is big, folks, so it's RX capital G. Brad, thank you so much for joining us today.
Yeah, I'm excited to be here. I'm excited to share what we're doing and see what people think. So I'm really excited about this.
So tell us first exactly how this solution, what problem is it going to solve for our friends today? Oh, wait. Before you answer that, I need to give you the ground rules, which are there are no ground rules. So our pharmacists have the floor at all times. They can ask questions at any moment, and I will answer those questions within this chat. So
Okay.
now that is out of the way and we all can act like feral folks, Brad, tell us what problem you are solving for us today.
We're really solving the problem. So don't just think pharmacogenomics. This is really going beyond pharmacogenomics, and it's really establishing revenue for pharmacists based on their clinical services beyond, including pharmacogenomics, but it's everything.
Okay. All right. And we'll get into what that everything means.
Yep.
So tell us a little bit about RxGenomix as a company, and then we'll get into your new solution.
Okay. So look, I don't know, in case some of you don't know me, I have been in practice since the mid-90s, and my mission in practice has been, and are we going to go over my slides or not go over slides? It's fine either way. I just want to know how much to share and when.
No, wait, if you're ready for slides now, I'll stop sharing and you can pull them up.
Oh, okay. Well, you'll see in the slides, and I can pull them up in a second. Let me pull them up real quick, and I'll just go
sure.
to that.
Yep, let's do that. You have control now.
Okay. Can you see my screen, or do I need to share it still?
You need to share, yeah.
Okay.
So it's the little green button on the bottom. There we go.
Perfect. So I have always said that my mission in practice has been to get pharmacists working with patients to get them on the right medications. So pharmacogenomics fits into that, but so do some other things. Using those medications the right way and achieving the desired results with medications. And really the key is this next step is getting pharmacists paid to do this, right? And so yes. I have been working in my career to do this from pharmaceutical care in the 90s. We were doing cholesterol testing and bone density testing and other services in the pharmacy. I then was heavily involved in the medication therapy management space and getting that established in Medicare Part D, and was heavily involved with almost every MTM company that's out there and very deeply. And then, I've gotten into the startup world. So I saw pharmacogenomics helped with outcomes in the initial days back in Iowa, helped with getting pharmacists doing vaccinations. And I saw pharmacogenomics emerging way back in 2010. I said, pharmacists need to own this space. Mm-hmm. And so that's kind of the next thing. I've been working on this, started RxGenomix in 2013 with multiple different fits and starts with trying to go through long-term care, through community pharmacy, Medicare billing, insurance billing. But really the model that we've developed is really, we go straight to employers, but how do we get it into pharmacies, and how do we make it simple and enable pharmacists to really do this and get pharmacists working on these things? And so that's really what this is all about. And what we're about to show you is our new solution, which really, I think, pulls it all together. And so because one of the, I don't want to give it all away, but let me know. You want me to go through this and then we can answer
Sure.
questions? Or?
Yeah, absolutely.
Okay. So we know, so I was president of the American Pharmacists Association back in 2019 to 20. Obviously, there's a lot of time leading up to that. I was on the board of trustees at APHA. We were working on provider status. How do we get pharmacists paid? And obviously, what ECAPS is making some progress. But at the same time, even with MTM, I always said we created a product, but we didn't create a customer. We never created consumer demand for pharmacist services. They didn't know what it was, what to expect. But yet we know pharmacists deliver high value clinical support. There's more and more studies that support that. But daily interventions go uncompensated. And part of the reason for that, there's no scalable reimbursement model. And there's limited patient awareness and demand for what we can really do. So the path forward is that we create that demand. One of the things I heard along the way was that the reason chiropractors got their services covered in insurance is because consumers demanded it. Like they had consumer demand for their services, so then insurance had to eventually cover them. We've never done that. We've given away our services in pharmacies. We're the most accessible and most highly underpaid healthcare professional out there. And we're suffering from that demise a little bit, right? And one of the challenges that we've also had with MTM and these other services is creating enough revenue from the services for it to be meaningful. Like I said, I was heavily involved in MTM, and some of the best pharmacies out there doing the most MTM at least would say, look, the most I can make is like $5,000 a year. It's not worth my time and effort for the level of effort that goes into doing it. And hey, that's real, right? And so I think we've created a model here that I'm excited to share and get people's feedback on that overcomes those things.
Okay.
So this is not just pharmacogenomics. It's really more like your concierge pharmacist platform, right? Okay. So think, not to demean it or diminish it a little bit, but think Uber, right? Uber has riders and drivers. Here, the riders are the patients and the drivers are the pharmacists, but you have your personal driver. And so here we have a two-sided app that we are bringing to market that we launched last week. So you can join, you can get in now. I'll describe all this. But here there's a patient side where the patients can establish their health profile, manage their medications. They can order their pharmacogenomics test and connect to a personal pharmacist. So think about this. Independent pharmacies have the best opportunity here because they have those personal relationships. And there's a lot of people out there that don't have those personal relationships. A lot of pharmacists out there in chains and others that move around or whatever. And now you'll see that a person can actually choose who their personal pharmacist is and have that person as their anchor for their healthcare. At the same time, a pharmacist can develop a panel of patients. When I say a panel, we had to find out how many patients can a pharmacist manage at one time. Is it 100, 200, 700, 1,000? You'll see why that matters when I talk about the reimbursement. They can deliver personalized care and drive engagement and outcomes, and for the first time establish recurring revenue for services. And so there's consult revenue and there's recurring revenue. So here's an example of the patient dashboard. So patients can check their medications, and you'll see I can bring up some screenshots to show you more, but it's focused on what I said at the beginning, the right medications, the right use, and the right outcomes. And they can see how they are on track with that through interacting with the pharmacist. The system will automatically tell them what their PGX eligibility is. And this is a risk stratification. We have sponsored programs. We're starting at 10,000 life group next month, and we need pharmacists to deliver on those services. You can then become the personal pharmacist for some of those patients that don't even go to your pharmacy.
Is this different from MTM that we do through outcomes and such?
Okay, yes, 100%.
Okay.
So the issue with outcomes and with other MTM opportunities is you're relying on what the payers say they're going to pay you to do, right? Well, here you are responding and interacting with patients, addressing their health concerns. And so there's a two-sided app, which has never been done before. And it's a web app that's adaptive to a mobile application as well. And then a person that uses the system can actually find a pharmacist. They can come in here and they can select a personal pharmacist. They can, if there's two pharmacists at your location, they can have more than one personal pharmacist. If it's a generalist pharmacist and they need a specialist, they can do that as well. And then what happens is we have incorporated artificial intelligence into the system, because one of the other challenges with delivering services is how long it takes to put a medication action plan together, how long it takes to put this. Well, we have AI generate the results and they provide some insights for a person. And then, but the whole point is they send the insights to the pharmacist for review. So the technical term is human in the loop, artificial intelligence. So we leverage AI, but we have the pharmacist, the human, to validate the AI. And then what happens is when they send it to the pharmacist receives it, they can do the review, they can edit what they want to, and they can send it back to the patient. We're actually even building in a way for pharmacists to message the doctors on their behalf, and they can see their total earnings, and they can see this is an old version of the dashboard because we're making changes quickly that I'll go into more of.
Sure.
But there's a subscription model for patients. So patients subscribe to the service at the level that they need. Could be a free level. And at that free level, maybe they're not on very many questions. Maybe they don't have very many medications. They need a consult every now and then. They can book an ad hoc consult. Or maybe they need one comprehensive medication review a year, or two every 6 months, or one every quarter. They can subscribe to the level that they need. And then the pharmacist gets paid out of those subscriptions. They get paid a percentage of the subscriptions, and then the other part of the subscription is used to pay them for the clinical consults. And so it's a combination of recurring revenue and fee-for-service revenue. And the way that this can look as an example is, I've heard just from research, it says the average pharmacist has 2,000 to 10,000 active patients, right? So at 25, 125, 325, and 755 members, which is 20% of your pharmacy patients. It's not like everybody, because not everyone's going to say yes, but there are people who need help. Some of the pharmacists that I've talked to have said, I get so many questions from people who can't even come to my pharmacy because of their insurance, but they have nowhere else to go. And I'm answering the phone, I'm answering their questions all day long. And I don't have there's not been a way for pharmacists to get compensated. Well, instead of just saying, maybe, I can't help you, or I can't for nothing, then just say, well, hey, we have a program to enroll in where we would love to help you with your medications and oversee or it could be, there's lots of different opportunities. It could be caregivers, right? Lots of us have older parents that we want watched over, and we can enroll them and have a pharmacist reviewing their medications. And I'll get into some of what we're doing here. But just as, for example, at 750 members, recurring revenue is $65,000 a year. And with the fee-for-service revenue of the consults, you can make a full-time pharmacist salary, much different than what you're making from MTM from the other opportunities that are out there.
Now, is the time commitment for the pharmacist only, or is this something that a tech or a clerk can assist them with?
We'll have to work through that. A lot of these are recommendations around the medications. So we'll have to work through some of that.
Okay.
So the other thing is we have to figure out, how do we sell this to people? We don't recommend to say, I won't talk to you unless you pay me, but we can position it a way, about added help with your medications. Oh, you see lots of different doctors. They probably don't know what they're all doing. Let me help coordinate your medications for you. One of the things that we do with pharmacogenomics that has been kind of the vision all along is that the goal and the utilization for a pharmacogenomics test isn't just one time, but how do we keep engaged with those people on their future medications? The only way that there's really been is to say, go, if you're on a new medication or thinking about a new medication, go look on your 40 to 60 page report and find it and see, or have a pharmacist look at it. Now I'm actually going to go into what the app looks like and show you a few screenshots.
Now on this subscription model, will the pharmacist have the opportunity not just to deal with their medications, but also give recommendations for things like supplements or
yes, everything.
Heather, drink more water.
So for example, so what happens is let me get to the patient view.
Okay.
I had it all set up before I got kicked out. So
I'm thinking for somebody like me who I am not on, the only medication that I'm currently on is my asthma inhaler, which I hardly use that anymore. However, in losing a whole human in weight loss, there were some times that I would have loved to have a subscription like this to be able to chat through with a pharmacist on what supplements I should be taking after my surgery, what thing, now that half of my stomach is gone, what medications do not absorb in my stomach anymore. Those kinds of things I would have gladly or will gladly pay a monthly subscription to help that along. I think it would have helped me. Well, gosh, I nearly lost all of my hair. Let's just start there.
What happens? How many young families are out there with newborns that are all want to know how to take care of their babies, or can I give them ibuprofen, or what's the right dose, or whatever? So here we have this dashboard that they log in. Once they log in, they see, and they can submit their action plan to a pharmacist. Then the pharmacist can review it, and it says, okay, we've done the initial AI insights. They can send it to the pharmacist for review. The pharmacist then receives it, it gives them their action plan back, and then they can do messaging. They can chat message with the pharmacist. They can book a consultation with the pharmacist and do a video consultation. Then you can do it in person as well. We're building in symptom checkers. So, I'm getting headaches. Could they be from my medication? Well, let's type headaches, and then let's answer some questions. How strong does it feel? When did it start? How often do you notice it? Etc. We'll answer these, and then we'll check it. AI will do a check, and then they'll get some insights, and it'll say, oh, a pharmacist should review this, so let's send it to the pharmacist. So that's just about the symptoms of a person's medications. Guidelines check. Okay, so guidelines is where over here in the profile, they enter their medical conditions. Well, how many patients do we know that have a medical condition and are not getting treated to the guidelines? There's studies out that are saying it takes 12 to 17 years for physicians to adopt guidelines. I was working with a hospital in San Diego recently, and only 39% of their patients were on the best medications for heart failure. Well, now a patient can come in, generate their guidelines, and then get a review, and they can send that to the pharmacist. Why we're flagging this? When you have hypertension and diabetes, you're not on ACE or an ARB. Well, they would never know what medications they should be on. Now a pharmacist can engage with them, but the pharmacist can engage with them, and they can pick their pharmacist. And then when the pharmacist goes to their profile, you can see your active patients, your services, your patient rating, your NPS score. You can go to your action plans, and I don't have any in here right now set up, but basically I was trying to show you that generative AI, where you can deliver a response, 5 to 10 minutes, you can generate a response instead of 30 to 60 minutes putting together a whole care plan together. And
now, Brad, I just want to make sure we're still all looking at your patient view, correct?
This one is the pharmacist dashboard, actually.
Okay, you're not showing us that screen. Thank you.
Okay. It's probably not moving around like I changing screens with me.
There we go.
Okay. Yep. So now you see active patients, CMRs, TMRs.
Yes, thank you, Jerry.
You can see your revenue. You can see your subscription base. pending activity, today's
There
consultations.
we go.
And not only that, but if it matters, if it's helpful, um, we can you see this view? Did it change for you?
Yes, it did.
Okay.
Thank you.
So this is actually the organization view. We can create a view for your pharmacy. So your pharmacies and admin level, then you have your pharmacists and as your patients, we can pull it all together. So we're out there, like I said, we've got an employer group starting next month. We have some existing employer relationships, and we'll be marketing this to get patients into the platform, get Uber riders into the platform, and we need pharmacists in here so that when a patient goes and they look for where's that page? When they go and look for a pharmacist, that they can find their pharmacist. I probably lost it in what I was trying to do here. Let's see here, my patients. Let's see. I'll pull one up. I'll just log in.
Sure.
Patient count.
So this is what a patient will see. This is what Heather will see when she logs in to get to her pharmacist.
Yep.
Now, I think the big takeaway here, Brad, that we haven't really I mean you hit on it, yes, but we haven't really dove into is reoccurring income. This becomes mailbox money. Yes, there is work. Like don't get me wrong. I'm not saying there's not work. There's work, but it's money that you can begin to see.
Yeah, like you have to keep your people engaged, right? You have to keep your patients engaged, but as long as you're delivering value and they're coming to your pharmacy, they're going to want to have access to you as a pharmacist in overseeing their medications, having that peace of mind from knowing their medications are correct, right?
So in delivering that value, do you set something up like, just like you mentioned earlier, quarterly medication reviews, yearly medication reviews? What are some other ways that we can keep our patients locked in?
Yeah, I think honestly, we're going to have a lot to learn as we do this because we have to figure that out. Like, for example, knowing, for example, what like right now I just logged in 0%, 0%, 0%. Well, a pharmacogenomics review, a nutrigenomics test done, were the guidelines reviewed in the last 6 months. We're going to build in deprescribing, right? So as they can move these numbers up, there's ways that we can keep them engaged. Have we reviewed adherence in the last quarter? Dosing times, are you taking the meds at the right time? And then lab values. So we have the whole section in here on lab values. And so over here in the profile, you can see their lab values. We're going to work on integrating with electronic health records. And are there lab values at goal, and are you reviewing them on a consistent level every quarter, for example, for A1Cs or quarterly or whatever, and then you communicate with the doctor. And there's lots of ways we'll build this out. We have some thoughts around vitamins and minerals and supplements and stuff that we can do. Like I said, the nutrigenomics test is there, and so we're just getting started, but a lot of opportunity to build off of this.
Now, is this cash or through insurance?
Right now, it's just cash.
Cash. Okay.
Now, we may go to health plans and say, hey, you want us to manage your population, you pay us, and we'll pay the pharmacist through that, but for now, it's on our terms, not on the insurance companies.
Right. No, I mean, we all love cash. We all want cash.
Yeah.
Will you be at Cardinal this year?
So I actually used to work for Cardinal Health. I know Jerry. So we're talking to Cardinal Health. We're a little bit too new to have gotten to RBC this year, but we are talking to them. Yes. But we will not be there specifically.
But you can book calls. I think Jerry probably wants to see a demo or talk to you in person, but he could book a call with you to do that.
So we've also to support this, we've created a circles community where we can collaborate. And we are going to have a webinar. Our first webinar is going to be next Tuesday at 1 p.m. where we can go over this, go into more depth. And we didn't talk about this. Let me go into this because I'm sure this is a question that will come up, which is, see, this should work. That's my, okay. So we don't charge pharmacists for the platform. There's no charge.
That was my next question.
So there's no fees for the platform. Look, we get paid a platform fee, typical subscription models do, and that's how we make our money. So you could currently there's a free plan, and we're going to create this enhanced verification that is going to connect to pharmacy profiles, which is a credentialing service. It's going to be $75 per year. That's the only fees. And then if you don't like our rates that we're charging, you can edit your rates. Maybe you're in an area you want to charge lower fees. Maybe you want higher fees. You can edit. And now we have to pay within the subscription fee model, but outside of the subscription fee model, I've had some requests. Can we make consults, like types of consults, like OTC consults or
Yes.
prenatal consults? And I think we'll work towards that. And then people can set their own fees for their types of consults, but haven't quite gotten there yet. You set your payout. You can pay yourself as a pharmacist. If you're working individually, you can pay the pharmacy, like whatever works for you, who's out there. You can see your earnings, so all accounting is in here. And you can integrate it with your calendar too. So when they go to book a consultation, then they can book it into your calendar as well. So we've got a little bit of work to do on that because it's only one way. We can't pull calendars, but we're working on that. Should be out in a couple of weeks. And so,
which is fantastic because for folks that feel like this may be too much overwhelm, if you connect your calendar, you can have
you can set your time.
Types, like I only take consultations Monday through Thursday, 8 a.m. to noon. That's the only times I think. So don't feel like this turns into a free for all where you have to be on call. You can set those guidelines to how you want your program to work. I think that's one very important thing to mention.
Yeah. Any other questions out there?
Nope, none yet. So tell us about onboarding. So Brad, you said the magic word, no cost to the pharmacy owner. No money cost. We understand that there will be time cost, employee cost, your own cost. Like, we completely understand that. But once I say, sign me up, Brad, what does onboarding look like? How much time? What are some real quantifiable things that we can know when we're onboarding?
So you go down here to create account the first time, okay? You choose a patient account or a pharmacist account. You want to see what the patient side looks like, you can create both accounts. And then you just have to use different email addresses. Also use your business email for the pharmacist and your personal for the patient or something like that.
Sure.
And then it's not, the onboarding is going to take you you'll have to have your NPI number. That's about it. You'll be up and running in about 10 minutes. And now we do have, let's see if I had this pulled up a second ago before my system crashed. I think we can provide, how do you promote this to people and get people interested? So we're working on some marketing materials that either they download or we can provide. But because we have to train people on this concept of having a personal pharmacist. It's all about getting on the right drugs, the right use, and the right results. And they can just scan a QR code and the patient can get going. And you can have that on your countertop. You can have a poster in your pharmacy. And we can assign you an organization code so that they only see your pharmacy so that you're not worried about that. And then we can also assign you as a pharmacist to other organizations so you can get more patients. And
this is just a great tool to make you the absolute expert in your field, in your community.
Yeah, absolutely.
This tool makes you stand out further than definitely the big chains, but also any others that may be competition in your community. This allows you to stand out. This is also something great that you could use for PR. Your local radio stations, your local bloggers, newspaper, all of those. This is all a great new program, fancy new program that I have brought to Bakersfield for the patients of Bakersfield, that they can have access to me. So this goes far beyond, I mean, okay, I was about to say something really stupid. Money is king. Cash is king. Yes, we want the money, but this also creates that trust and that level of you are the most awesome in your town that just normal advertising doesn't do. This gives you the backup to the awesome marketing that you're doing.
My thought with pharmacogenomics was always that as a patient, once you had their pharmacogenomics test done, they would always want to come to you because you had their genetic test. Look, they come in here. I don't know if I highlighted it. Drug checker. I'm going to be on a new medication. I'm going to type in my new medication, analyze the medication against my genetic report that exists. So I don't have to search that report. I know where it was stored, and it gives me an AI insight, and I need to send that to the pharmacist for review. They could be right there in the doctor's office. They could be at home, wherever. And same with symptoms, like I said, guidelines check, et cetera. They have any questions, they need to message the pharmacist. Let me message my pharmacist. And I have a question about a patient. All right. So that goes to the pharmacist and then they can review it.
So this is very exciting because the general public is getting more smart about testing, about pharmacogenomics, about what supplements they should be on, what drugs they shouldn't be on. You know, all of the, as much as we hate TikTok for misinformation, it's doing a great job of making people aware so they go find the correct information. And this gives you a tool to be awesome. Does anybody have any questions? The cost for DNA testing.
So what we typically do, you can order a test kit. We listed it at $4.99. And what we typically do is we give a coupon. So you look at they're getting a benefit through you. So for $2.99.
That's fantastic. It's fantastic. Anybody have any other questions?
And I guess one thing on that, you might find, like, we have one pharmacy that reached out by chance this week. She had worked with us in the past, and honestly, it's what typically happens is really difficult. But what she found, her pharmacy is a compounding pharmacy, and they own some clinics, and her clinics are ordering the GeneSight test. And with the GeneSight test, like, it's a great test in some ways, but they only report out and do psych meds, and there's so much more, and they don't have any way to keep following up like this provides. So we're going to implement them next week and get them going, and I'm really excited to do that with them. And my whole point that the GeneSight test is $300. It's very market. Yeah.
Are you seeing any insurances paying for DNA testing yet?
No, but we're seeing more employers. We're seeing more employers starting to recognize the opportunity and pay for their people.
That's fantastic.
Our client, like I said, we got a 10,000 life client. I don't know if you know of Mercer. Mercer is the largest healthcare consulting group in the United States, and it's our first Mercer client. So we're excited about that, and hopefully it'll grow from there once they see this. So.
That's fantastic. Well, we've gone a little bit over. I'm so sorry, everybody. We had a few technical difficulties.
Sorry about that.
Trust me, A-okay, Brad. So a few things here. In the replay and the show notes, if you are watching this on YouTube, will be how you get a hold of Brad and his team. Also, we will have the link to register for his upcoming webinar where he's going to do an absolute deep dive into the platform. We're happy to do that. If you have any questions about DiversifyRx, PBU membership, please reach out to us. Max, I'm so sorry I didn't get to any of your questions. If you want to see any of the programs inside of Pharmacy Badass University. I'm happy to walk you through it and show you what's in there and available. Thank you so much for coming, Brad. Thank you so much for, we had a little bit rough go at getting you on, but I am so pleased you're here. You'll have to come back and give us some updates.
Yeah, I would love to.
See how it's going, how it's evolving. Thank you guys so much for hopping on today. I will see you all in 2 weeks. Bye-bye.
Thank you, Heather. Appreciate it.